Hello, my name is John Velasco. I'm with Dayton Surgeons, and my specialty is vascular surgery. I thought I'd talk to you a little bit about venous insufficiency and varicose veins. There are many symptoms of varicose veins, and if you're here in the office today to see me, they must be bothering you. Now, what are some of those symptoms? Well, they can range from itching to burning to stinging to heaviness to swelling to bleeding. Sometimes you can have ulcer formation, you can have skin changes. There's a variety of manifestations of symptoms from varicose veins, all of which can contribute to your symptoms of pain and heaviness. And there are ways that we can treat them both surgically and non-surgically. Now, significant parts of history that are important to know in the treatment of varicose veins may include: is there any history of varicose veins in your family? Meaning, did your mom or anyone in your family have varicose veins? Because if they had varicose veins, there's a higher likelihood that you're going to have varicose veins. Is there a history of trauma? Did you have a broken ankle or fractured your leg and then noticed after that you developed varicose veins or swelling in the leg? Well, that could be related to the symptoms that you're having, because if the veins were damaged when you had the trauma, that could be contributing to the problem that you're having now. Another potential cause or contributing factor to your varicose veins could be if you have a history of blood clots in your legs, also known as DVT, or deep venous thrombosis. If you have a history of that, that probably also is contributing to some of the symptoms that you're experiencing with varicose veins and venous insufficiency. So what exactly is venous insufficiency? Well, it's a condition where the veins don't work properly. And let me explain. Your veins are a way for your blood to return to your heart. You have essentially two sets of pipes in your body. There are arteries, which take blood away from your heart and direct the blood towards your hands or towards your feet. And then you have veins, which return the blood from your hands or your feet or from the organs. The veins return the blood back to the heart. In the case of venous insufficiency, the veins do not conduct the blood to the heart as they normally should. And let me show you. In this diagram, this is essentially a drawing of veins in the leg. Now, you have valves in your veins. There are little leaflets that are within each of the blood vessels that normally open and close. So, when you walk, your muscles squeeze, the blood is pushed by the muscles upward in the leg, the valves open. When you relax, or if you're just standing still, or if you're just sitting, gravity wants to pull the blood back down into your foot. If the valves are working properly, the valves will get pushed together. They will close and prevent the blood from falling further down into your leg. Now, in the case of venous insufficiency, if you have venous insufficiency, these valves stay open. So what occurs? The blood falls back down into the leg, and that extra pressure over time causes the veins to distend or get larger. And if they get larger, potentially, as the vein increases in diameter, it moves these two leaflets further and further apart, thereby making more blood fall down in your leg, which exacerbates or makes the problems worse. And over time, you'll start to see that as leg swelling, or even the varicose veins, which appear as, in some people, bags of worms underneath the skin of bulging veins. Now, the veins themselves aren't necessarily these large veins that you can see outlined here on this diagram. Usually they are branches off of the veins that you see. For example, if you were to imagine the veins in your leg as a system of branches, twigs, trunks of a tree. In this case, the flow of blood goes from the leaves to the twigs to the branches to the trunks and eventually to the main trunks. So the blood starts in tiny small veins, then moves into bigger and bigger and bigger and bigger and bigger veins. Well, if the problem is in the main trunks that the valves don't close, the blood will go back down the other way and over time distend the smaller branches. And you can see that manifested as in several ways. You can see it as the veins bulging underneath the skin, and those are known as varicose veins. But sometimes you can even see them in small veins underneath that are just in the skin themselves, and you may know these as reticular varicosities or even spider veins. It's all related to the same sort of process, just to varying degrees. So, how do you treat it? Well, there are essentially two ways to treat it. One way is to wear stockings. Now, the stockings can help in a couple of ways. One, they provide compression, and the compression helps to keep the veins from being distended. And by doing that, by keeping the veins from being distended, it helps to cut down on the symptoms of the heaviness, the pain, the swelling, the itching, and the burning, all of which can occur from having varicose veins. By wearing the stockings, it helps to keep those symptoms at a minimum because it keeps the veins, again, from being swollen or distended. Now, another potential option for treatment is surgical treatment. And in that case, we would actually surgically remove the veins, and there's a variety of ways to do that, of which we can talk about that more, should that be considered an option for you. As far as the surgical therapy is concerned, it may consist of more than just removing the veins that you can see surgically. It may also include actually treating the greater saphenous vein here, which runs along the inside of your leg. It may require treatment of that vein either by surgically removing it or potentially treating it with a laser. Now, should you be someone who is considered for surgical therapy, it usually means that you've worn compression stockings for at least a couple of months. Most insurance companies require that you wear compression stockings for about 2 months to see whether or not you receive any benefit from the stockings and to see whether or not it helps your symptoms. Now, should you be considered for surgical therapy, you will most likely be required to get an ultrasound prior to the operation. And essentially, the ultrasound will tell us whether or not you have reflux, which is important to know because it will determine whether or not we need to treat the saphenous vein at the time of the removal of the varicose veins. And let me explain. As far as surgical treatment is concerned, oftentimes if you remove the veins that are bulging, the varicose veins that you can see in the leg, that oftentimes helps to relieve the symptoms that you were having prior to the operation, whether or not it be heaviness, burning, itching, or whatever. But it's very much like plucking the leaves off of a dandelion but not removing the roots. If we just treat the varicose veins and you have reflux in your greater saphenous vein, if we don't treat the greater saphenous vein as well, then very much like a dandelion, you're going to grow more varicosities over time. But if you treat the roots, in this case the greater saphenous vein, which may be feeding the veins, the varicose veins that you see on your leg, it markedly decreases the chance that you'll have return of varicosities down the way. Now, as far as the operation is concerned, should you be considered for it, it is usually a same-day operation. Most patients come in that same day and they go home later on that same day. The operation itself can vary in time. It may take 1 hour, it may take 2 hours. For you, it's usually 5 minutes, meaning you come in, the anesthesiologist gives you the anesthetic, and you fall asleep. When you wake up, the operation's done. It seems like it took 5 minutes. For your family, it may take a couple hours, maybe 3 hours of waiting before you're able to go home, given the extensiveness of the operation, depending on how many veins that you might have. Now, what can you expect as far as potential complications? Well, as far as complications are concerned, for surgical removal of varicose veins and potential laser treatment of the greater saphenous vein or surgical removal of the saphenous vein, the complications tend to be, again, usually the minimal risk from anesthesia, bleeding, and infection. Bleeding and infection tend to be the most common encountered complications from this operation. Now, that's not to say it happens a lot. Actually, it's very rare. We take precautions to make sure that you don't have problems from the operation, including cleaning your skin preoperatively with an antiseptic solution and treating you with antibiotics preoperatively. Additionally, if you are on blood thinners, oftentimes we'll ask you to discontinue them to help decrease the chance of bleeding around the time of the operation. Now, what can you expect post-operatively? As far as post-operative care, usually when you wake up from the operation, you'll find that your legs are bandaged with ACE bandages, usually from your ankles all the way up to the top of your thighs. Underneath the ACE bandages, you'll find gauze. Underneath that, over the incisions, which usually are small puncture incisions, you'll find pieces of tape which are essentially bringing the skin together over the incisions. There won't be any sutures to remove. Usually, we'll have you remove the ACE bandages the day after the operation and also remove the gauze the day after the operation. I'll ask you to keep the tape, or the steri-strips as they're known, on your skin for 7 to 10 days. If they're still on after that, you can take them off in the shower. But the day after the operation, after you remove the ACE bandages and you remove the gauze, it's okay to shower. When you get out of the shower, you need to rewrap your legs with the ACE bandages, again, from your ankles to your thighs for another 24 hours. After another 24 hours, you can remove the bandages and just leave them off. So that means essentially 2 days or 48 hours worth of compression, and that helps to cut down on bruising and also helps to cut down on pain during that time period. As far as pain is concerned, usually the pain tends to not be too extensive, but we will send you home with prescription pain medication should you need it. If you don't need it, extra strength Tylenol, Motrin, or Advil, those are fine. As far as driving is concerned, usually we ask you not to drive for a couple of days after the operation, and certainly not if you're on the prescription pain medication. As far as activities are concerned, that first day we usually ask you to take it easy. So if you had your operation done on a Monday, usually we'll just ask you to go home and take it easy Monday afternoon. On Tuesday, you can try to resume usual activities, but just around the house. I wouldn't recommend that you go shopping or go back to work that first day. Most people are pretty sore, and to take a few days to take it easy is not an unreasonable thing. As far as increasing your activities, usually after a couple of days, if you're not having too much pain, it is okay to increase your activity as tolerated. Most people within 1 to 2 weeks are able to return back to full usual activities without any difficulty. So as far as work is concerned, most people, I ask that they tell their employer they should expect to be off of work about 1 to 2 weeks, depending on how quickly the patient is able to recover from the procedure. As far as follow-up is concerned, after the operation, I'll ask to see you in the office generally at about 1 to 2 weeks after the procedure, and then usually at about 6 to 8 weeks after the operation. Oftentimes, I'll ask to see you the week after the operation so that we can take a look at your incisions and assess what your activity and pain levels are to see whether or not you're able to return to work quickly or whether or not you might need more time off of work. The second visit, which usually occurs at 6 to 8 weeks, is to see you after you're done with being sore and the bruising is resolved, usually at 6 to 8 weeks. It's just a quick check, and most people at that time are doing very well, and the results of what you see on your legs are very close to what you can expect them to be long term. It usually takes, though, 6 to 8 weeks for the bruising and the pain and the soreness to finally completely dissipate. That's not to say that you're able to return to activities sooner than that. It just means that usually it takes about that long for you to be essentially back to 100%. So in conclusion, varicose veins or venous insufficiency can be treated both with medical therapy, which usually means compression stockings, or it can be treated from a surgical standpoint, which may mean treatment of the greater saphenous vein with laser or surgical treatment, and also removal of varicose veins. The procedure, should it come to surgery, tends to be an outpatient procedure, of which the side effects tend to be minimal, and the time off of work tends to be minimal as well. Most people are able to return back to usual activities within just a few weeks with good results. Now, if you have any questions or concerns regarding anything that I've talked about with you here today, feel free to contact the office with any questions. If you would like to talk to me personally, I'd be happy to do that and answer any questions you might have. Thank you for your time.